periodontists, and what that is specifically dental specialists who deal with the health and preservation of the gums and the bone of the mouth. A wide variety of services that we do to help somebody retain their teeth and keep them actually very healthy.
The basis of any good smile is the gums and the bone. What we do here is make sure that that foundation is strong and our patients have a healthy mouth and lifestyle.
Yeah, it's pretty cool because people come in with a variety of problems and we happen to be able to fix a lot of them. So we can make big improvements, not just smile-wise, but overall quality of life.
One of the biggest problems that we see with patients is missing teeth. And that can be from trauma, it could be from infection. Some patients just outlive their teeth for whatever reason, and there are quite a few patients who have already lost their teeth and now are in dentures and are unhappy with the denture scenario.
By the time you get into your 70s, about a quarter of the population of the teeth are going to be missing, and they're going to be into dentures. For anybody who has worn dentures or been around people who have worn dentures or even partial dentures, it causes a lot of bone resorption, it causes a lot of loose fitting teeth, and eating becomes a challenge, and social engagements become problems. And it's not really talked about tremendously, but there are a lot of easier solutions or more permanent solutions that can be addressed using implants. And we're not just in the business of making people better and healthy and comfortable. We can bring back their youth and their social aspects of life.
Post-op downtime is not that significant, but I think a lot of people have it in their head that this is a super invasive type of procedure, and the truth of it is really it's not.
I would say most patients after an implant don't even need pain medication afterwards.
Yeah.
They can go back to work the next day, they can function the next day. It sounds a lot worse than it is, but it's as far as noise and the procedure, it's not much different than getting a filling done.
In the dental world, it's one of the most, and this is very hard for people to wrap their brain around, it's one of the most conservative types of dental treatment that is done.
Without the tooth there to stimulate the bone, we tend to lose it, which around dentures or bridges may essentially not be an issue, and it may work fine when they're first placed, but then after years down the road, the dentures will become loose, gaps can form around bridges and not be as aesthetic or not as appealing, or can hamper speech or even your ability to keep it clean. Implants, by actually going down into the bone, they secure that bone, they stimulate the bone, and we maintain the bone. One of the biggest problems that happen is that you begin to lose the bone that supported the tooth. When you lose bone, you tend to get more of a sunken look, more of an aged look, and implants help us bypass that.
An implant and another tooth replacement option are very, very similar in price. And so I don't want people to think of that as a big barrier to entry, really. There's a lot of options and a lot of different ways to utilize implants so that you can actually make it affordable and comfortable and aesthetic and cosmetic and function well all at the same time.
We're, as an office, are committed to improving the overall foundation of our patient's smile. And if you feel like that smile is something that you want to improve on, we're always here to talk. Our consults are free, and we'll sit down and go over every restorative option there is, including implants if you want.